Hi, everyone. Thank you so much for joining us today. My name is Priscilla Medeiros. I'm the Knowledge Mobilization and Community Engagement Specialist at the Edwin S. H. Leong Center for Healthy Children, as well as your moderator for this series. I'm incredibly excited to welcome our speaker for today's webinar. We're joined by Dr. Sobia Khan, who is the Director of the Implementation at the Center for Implementation, and an award-winning global expert on how to practically implement complex interventions in complex systems. So for over 20 years, her passion for integrating multiple fields such as implementation science, systems thinking, and social network theory to achieve large-scale change has been illustrated through her multitude of work on implementation projects. So today's presentation will provide a practical foundation in implementation science, including how it can benefit your work and how it can be applied in both research and practice. So thank you so much, Sobia, for joining us today. I'll hand it over to you now for the presentation.
Awesome. Thank you so much, Priscilla. And thanks for everyone for joining during your lunch break or some other point in your morning or afternoon, depending on where you're calling in from. This is meant to be a super high level introduction to implementation science, hence the 101. And it's meant for people who would like to learn more about what implementation science is, how it applies to your own work. And for those of you who are more experts or have more expertise in implementation science, it could reinforce certain ideas, and for those who are familiar with the field. So hopefully there's something here for everyone who's joining today. And I'm not going to go over my bio because Priscilla just did that. The one thing that you should know about me, though, is that I love complex problems and thinking through solutions to them, even if I don't always have the answers. And that's kind of how I came to this field because implementation science is incredibly complex. No one has the exact right answer. Even what I'm going to teach you today is not like the be all and end all of how you implement, but it's meant to be like a field that generates ideas and gives you some direction on how you could implement more effectively. And so I like the process of sitting with people, supporting people through their implementation problems, thinking about how to approach things in different ways. And I love integrating those different fields so that we can think of new perspectives and new ways of generating solutions. So that's really what I love doing. And that's also what we do at the Center for Implementation. That's our specialty, supporting people through their implementation journey in different ways. We're a small social impact organization. We're known for training, but we also do a lot of other things. So we do workshops like this. We have online courses, but we also develop tools. And so there are a few tools that I will show you at the end of this presentation today that you can go to. They're freely accessible. And we also support other people to develop tools. We help people to develop their own implementation training. We enter long-term partnerships. So, and this could look like a lot of different things. It could be like a research collaboration. It could be supporting people to build an implementation infrastructure. It could be training people over the long term. So we do work like that. There have been a lot of people who are thinking about how to embed implementation science into their own organizational structures and workflows. And so we've been working with people on how to use implementation science strategically within an organization. And we also have been giving feedback to research projects as well as practice projects on how to better strengthen their implementation science components. So as you can see, we work with people in a lot of different ways, and a lot of what I'm going to be talking about today is informed from this experience that I have, like supporting people through their implementation problems and what are the common questions that come up when they're first introduced to the field. So the agenda for today, this is we have quite a few parts in 1 hour, so not a lot of time to cover a few parts, but the intention is to cover those like really frequently asked questions that I get when people are new to implementation science. So the first question obviously is, what is implementation science? And I'm going to tell you what I think it is in my own words and my own experience. The second part is, why are there so many theories, models, frameworks, and approaches? That's a very common question that we get. Maybe a question that you've had if you've like Googled implementation science and tried to read through all the papers on it. Part three is, what is the one thing I should know really well in implementation science? And I'll describe a bit where that question comes from and how we might approach the answer to that question. And then part four is, how much implementation research am I doing? So for those of you who are doing implementation research, what can you do to embed some of this into your work and to think about it a bit earlier on than you usually do? And then parts 5 and 6 are super quick. I'm just going to we included some tools and resources if you're getting started. Where can you go? What can you freely access? And then part 6 is just next steps and some time blocked out for Q&A in case you have questions. Priscilla, I'm going to check with you. If people have questions during the presentation, can they just enter them into the chat?
Absolutely. And I'll keep an eye on them coming in as well.
Awesome. One thing that I'll note about the agenda is there will be some interactive activities throughout. And we might be using some of the Zoom features to do this, like Zoom annotation. So I will walk you through how to do that if we use one of the Zoom features. But we're hoping to get some interaction from you as well. So you won't be hearing me talk constantly for an hour. Okay, so the first question that I'm going to answer, what is implementation science? Let's all get on the same page and think about what implementation science is and how it can be useful to your own work. So the way that I like to think about implementation science is that it's about understanding and facilitating change. So think about any time you've implemented something. So a lot of you have a lot of practice experience. A lot of you have research experience. You've probably in your life implemented something at some point. If you think about what implementation is all about, at the heart of it is change. We're always asking people to do something differently about their work. So, for example, if you're asking a surgeon to adopt a new procedure, if you're asking a nurse to take on a new task, they have to do something differently about their day to day to adopt this thing that you're implementing. And so when you think about it like this, it turns into a process of understanding the processes of change, the context for change, and obviously there's some sort of behavioral science and system science that's like embedded in there as well. And so it's interesting because many years ago, this is probably over 10 years ago now, I was presenting at Health Canada about like doing an implementation science 101. And the mental model that people had when they think about implementation science, they were just like, isn't implementation just project management? And I was like, absolutely, there's a project management component because you have to make plans and you have to have those documents that outline processes. But it's more than that. It's about understanding how to implement change. So, what are some of these things that implementation science brings to the table in order to understand change? Okay, so when you usually start implementing something, the first thing that you probably think about is what is my roadmap? Where am I going to go? What are the next steps and stages so that I can plan out my implementation approach? And for that, implementation science has generated implementation processes. What are the standard things that we can do in order to make implementation happen? You also are probably going to be using implementation strategies. So things like training, reminding, maybe there are organizational level strategies at the leadership level. Maybe there are system strategies like procuring resources or policy change that have to happen to make sure that implementation happens as you would like it to make some sort of impact. And so we have rigorous processes of selecting implementation strategies that are theory informed and evidence informed. You also are probably wondering, okay, what's going to affect implementation? Because implementation doesn't look the same everywhere, right? So, like in your own hospital setting, in your own clinic setting, it might look one way, but if you moved that to, let's say, a rural clinic, if you moved it from downtown Toronto to like Nova Scotia, it might look completely different. And so you want to understand what are those factors that are contextually relevant, that promote good adoption, implementation, and most importantly, sustainability. And then if the thing that you're implementing is seen to be effective, you're probably thinking about spread and scale, right? You're probably thinking, how do we get this into more places? Or how do we vertically scale this up to policy? And so implementation science can give you that as well. It can describe some of those processes as well. So one thing that can be a bit confusing when you get into implementation science is that there's a lot of different terms that people use within the field. And so we see implementation science as this umbrella term for a bunch of different things that people might be doing. So I'm going to start off with implementation research. So you might be a researcher who is doing implementation research, and that essentially means that you are trying to figure out the best ways to implement something. And whatever you generate in terms of your findings feed into the overall science of implementation. You could also be doing implementation practice, and this is gaining a lot more popularity in terms of like recognizing this as a field of practice. Like your time is dedicated to actually doing the implementation work. So you could be a practitioner where like you are part of an implementation team. Maybe you're a lead, and this is what you do day in and day out as part of your work. And you also might be supporting implementation. So you might be supporting multiple teams or multiple people to implement something. And so you could be using evidence from implementation research in practice, or you could be generating findings in your own practice that feed up into the science. Like to say, like, hey, we're seeing that relationships is a huge part of implementation practice. Is this something that you should be focusing on in research? And does this contribute to the overall science of implementation? So that's kind of like why it's under this umbrella of implementation science, because whether you're doing research or practice, the idea is that both of these things build up this applied science overall. And so you'll see there's kind of like this overlap too, this Venn diagram, because in a lot of our talks and conversations with people, they haven't been able to cleanly put themselves into a research bucket or a practice bucket. Sometimes you do a bit of both. So for example, if you're a clinician researcher, you likely are doing both of these things, right? Like you're doing your practice work, but you're also like figuring out what are the best ways we can implement. Should we do a research study? So you might be wearing many hats and you might be supporting implementation, but you're also a researcher. You might be both a researcher and practitioner. And so there is this like this really intimate relationship between the research and practice piece because implementation science is so inherently applied. Okay, so let's say you identify with implementation research primarily. Like this is the place where you're like, this is what I do. Let's dive a bit deeper into what that actually means. So when you're doing implementation research, you are undergoing the scientific study of implementation strategies, processes, and approaches. So in a standard trial, you have an intervention. Let's say it's like HPV vaccine. And so what you're doing in a standard trial is you're trying to understand the efficacy or effectiveness of that vaccine. And so everything you do is to measure the effectiveness of that intervention. When you get to implementation research or you're using implementation science in your research, you have an intervention and you may also be wondering, okay, what are the strategies that are effective to implement the intervention? So like we not only have this vaccine, but we know it's difficult to implement. What are some of the things that we can do to help promote uptake and adoption or spread and scale? What are the things that we could be doing to make sure that this gets embedded within public health programs, within clinical programs? And so you're not just looking at the vaccine, you're looking at the strategies to implement the vaccine, and you're doing the research on those, and you're trying to understand which strategies were the most effective to promote vaccine uptake. So you see there's a bit of a difference between a standard trial and an implementation research study, where the focus in an implementation research study truly is on that implementation process or the strategies. You're looking at the how and what effectively makes the how versus what is the efficacy or effectiveness of the intervention itself. Now, if you're doing implementation practice, there's a way that you can use implementation science in what you're doing. So let's say, for example, you have a care delivery model that you are trying to implement into a rural hospital. You can use implementation science to guide how you plan and carry out these real world programs. And so, for example, one of the first things you might do is try to identify and define the scope of change. Who needs to do what differently? There are tools and resources in implementation science that can guide you through that process. There might be many barriers and facilitators to implementing this care delivery model, and there are tons of frameworks that you can use to help you understand those barriers and facilitators to change. You might be wondering how to select and enact change strategies to implement that care delivery model. Again, that can be guided by implementation science. And finally, if you want to sustain, which hopefully you do if you're implementing something and you're looking to continuously improve, there are methods and approaches in implementation science that can inform your sustainability plans and also your continuous improvement plans. So essentially, you can use whatever you learn from implementation science in a practical manner as well to make sure that you're embedding programs into your setting in more effective ways. So that is my like high level in a nutshell what implementation science is and how it can be relevant to all different people wearing all different hats. And so I would love to do a bit of an activity to learn more about who's in the room and what you identify as in terms of like what your implementation role is. So we're going to use Zoom annotation and I'll walk you through it in case you don't know how to do this. So the top of your screen, you'll see my name. This is it's Sobia Khan screen. And beside it, circled in red on the screen right now, you could see there's like three little dots. If you click on that, it unravels this menu. And you can go to annotate in the menu items. And I see people doing it already. If you'd like to practice, you can practice on the screen. Annotate, pick the stamp tool, the little check mark, and you can pick whatever stamp you want. You can pick the heart or the X or the star or whatever. I see some people drawing, and you can literally just interact directly with the screen. And there's a shortcut as well. So some people in different versions of Zoom, on top of your audio button, you have that little pen. If you click on that, that's a shortcut to the same menu. And so I'm seeing a lot of things here. Great. Okay. So I'm going to ask you to use this in the next activity, and then we have an activity later where you're going to be using annotation. If you're having difficulty, just type in the chat if you'd like to. If you're like, I cannot get annotate to work, you could, or if you're using an iPad or something and you can't get it to work, don't worry about it. Just type in the chat. So I'm going to tell everybody to stop so I can clear all of this out. Let's clear. Okay, so we're going to go to the activity. So I'd like to know, based on what I described, what is your current role? Do you associate with implementation research? Do you see yourself more as an implementation practitioner, whether you're practicing like you're online, sorry, on the front lines implementing something, or you're supporting implementation? Or do you see yourselves doing both? Like you wear both hats and you can't really distinguish between the two? Okay, so I see a lot of people doing implementation research and both. A few people who are more practice oriented and not really doing the implementation piece. And like, ooh, and we're getting specific. People as practitioners and some people who are supporting implementation. Okay, I'll give you another 30 seconds or so to finish here. I'll see if anything's coming through in the chat. Krista's saying both. Awesome. Okay. So I'm seeing a lot of implementation researchers and a lot of both. Okay, we're going to go 3, 2, 1, stop annotating. Okay, I'm going to clear. So this is incredibly helpful information for me because now I know that we picked the right topics for you. So we have some things. So the next few questions are things that both practitioners and researchers can use. And then we have like a special section towards the end that is just for researchers, just to kind of situate where you are in the implementation research spectrum. Um, so we're going to move on to the second question. So I just covered what is implementation science. Next, I'm going to cover why are there so many theories, models, frameworks, and approaches in implementation science. So again, if you have been looking at what is implementation science on your own, and you did what I did like many, many, many years ago, I was like, what's implementation science? And I was typing this to like, search engines, and all these papers come up and they're incredibly complex. And it was just like very theoretical. You're probably wondering, well, why is this the case? And why is it so overly complex? I will agree, it's overly complex. There's a lot to wade through. Tons of things that you can use to strengthen your implementation research and practice. I think there was a scoping review that came out probably like 6 years ago now. And at that time that it came out, there were over 130 implementation science theories, models, and frameworks that people could use. So it's a lot to have to digest when you're new to the field. You're like, why are there all these things? So I think there's good reason for this. They can be incredibly useful tools if you know how to use them. When you get into implementation science, you'll notice how incredibly grounded the field is in theories, models, and frameworks. And this is for a few reasons. The first thing is that I said that implementation is about change. And so if you want to understand change, you have to have ways to understand that change. For example, like theory, to understand the mechanisms of change. Also, many of you are likely working in complex systems. Implementation is not simple. It's complex, and you're also working in complex systems. So there's a lot of sense making that you have to do. And so these kinds of things can help you wade through the complexity, can help you structure some of the complexity to help you think about it in different ways. It also helps you have conversations with teams. I find that, like, for example, a framework could be useful to like have a common language with other people in terms of what's impacting implementation. because implementation is a social process. You're doing it with other people, so it helps to have a common sense of what's affecting implementation. They can also be super useful if you're doing research as like coding frameworks or things that help you build your theory of change. And so again, these can be incredibly useful if you know how to use them. So super quickly, I'm going to go over why these are super useful and some really common examples of things that are used in implementation science. So theories are a huge component of implementation science. You cannot escape theory in implementation work, even if you try. And it's because they describe causal mechanisms of change. So I said it's all about change. You have to know how you anticipate change to happen and what kind of outcomes you hope to see as a result of changing something. And this is all theoretical. This is all based on theory, right? And so it really helps you to have an explicit theory to clarify how you think change is going to happen and what you expect it to achieve. So, for example, if part of your implementation plan is to train people, what do you hope that's going to achieve? It's going to build people's knowledge. And if they have more knowledge, then they can do X, Y, Z more proficiently, and that reaches certain outcomes. That's a theory of change, right? That's a theory that describes the mechanisms of what you think is happening. So there are some really common theories that are used in implementation science to help describe what's going on in terms of different mechanisms of change. You can describe individual change, you can describe organizational change as well as systems change in different ways. So COM-B, the capability, opportunity, motivation, behavior theory is a really common one. Normalization process theory is another common one. So again, it helps to be explicit because there's always theory in implementation. It's usually implicit, but being explicit in your theory really helps you when you're doing both your research and your practice work. There are also models, or what we call process models, in implementation science, and these specify the stages in a process that are not necessarily linear, and they often involve this back and forth, kind of like going between steps. The best way that I heard process models defined was when I was presenting a workshop, kind of like this, like an implementation science 101 in Uganda. And it was for for physicians and nurses. And this nurse put up her hand and she's like, I was going through the knowledge to action cycle. And she puts up her hand. She's like, okay, I get it. This tells me where I need to go and also what I might have missed. And I was like, that's exactly what it is. It tells you where you need to go. And it also highlights gaps, like what you might have missed in the process. So you can go back and do those things if you're finding that you have gaps in implementation. And so process models are a really great resource to use if you're like trying to outline steps of something. So for example, if you want to know how to make adaptations, there are process models for that. If you want, like overarchingly, you want to know how to build an implementation plan, there are process models for that. And so like that can help you understand the steps and stages of doing those processes. So some really common process models in implementation science include implementation mapping that helps you select strategies, the knowledge to action. It's called a framework technically, but like if you look at the action cycle, it's actually a process model. It outlines steps and stages to help you get to certain outcomes. There's also one called Getting to Outcomes that was developed in prevention science and is used widely in implementation science. And then we developed our own process models at the Center for Implementation. This one's called the Strategies Pathway. I'll show it to you briefly in a few slides, but it describes how to select implementation strategies. So frameworks are also widely used. I think it's the most used thing in implementation science. It's what people are most familiar with. It's the most, it makes the most sense to people, I think, because it helps you identify key factors that could influence the implementation process or its outcomes. I like to think of frameworks as sense making or structuring tools. So like when I was talking about, working with teams and having something that gives you a common language for what's impacting implementation, this is what I find is useful about frameworks. If you're doing research, you can use a framework to help you code data. So for example, if you have barriers and facilitators, a framework can help you understand how to make sense of those barriers and facilitators as they pertain to implementation. And so some of the most common frameworks are the Consolidated Framework for Implementation Research. This is probably the most widely used framework in all of implementation research. I think it has like over 1,000 citations and they have like multiple versions now and it's continually being updated. I even have like a CFR, it's called a CFR for short, a CFR, like a temporary tattoo that they that they gave out at a conference. Like they have swag. They're it's very, very popular to use a CFR. Re-aim is very popular. It's a framework for how to classify implementation outcomes and how to select implementation outcomes. And then we've designed our own framework to describe context and implementation context. And we call it the context compass framework. Again, usually frameworks are just lists of factors, like things to keep in mind. So that's why they're so easy to understand. Finally, we have approaches. Approaches is like, we call it like this catch-all term to describe any other tools and strategies that you can use to help you through the implementation process. We kind of made up this term. It does, if you like Google like TMFs, it's usually theories, models, frameworks, like in the literature. But at the Center for Implementation, we added approaches because there's so many things that people use that can't be classified as theories, models, and frameworks, but they're so essential to doing implementation work. An example is the ERIC list of implementation strategies. It's not a framework or anything, it's just a list of strategies, but it's so widely used. It's like a list of 73 implementation strategies that are like commonly cited. And people often go to this list of strategies to understand what they could use in their own implementation work. Or Proctor's taxonomy of implementation outcomes. I always cite this. Like it's like something that I always cite as something that helps you understand the types of implementation outcomes you could be capturing. It's not a framework, it's not a model, it's just a taxonomy. And then we have our own tools, like the strategies tool that we've developed that can help you go through certain processes or to apply to your work. So again, catch all, but it's helpful to know that there's other things out there to help you in your implementation work. So hopefully that was clear to you. It helps describe why this is so important to your work in terms of understanding theories, models, and frameworks for implementation science. So I'm going to ask you, we're not using annotation this time, but I do see people like to use the feature and they're annotating on the screen. Type your thoughts in the chat. What are you currently using? If you think about theories, models, and frameworks, what are you using? Have you found them effective? I'm just going to give you a few minutes. Just type in the chat. There's also a way that you could type on the screen if you guys are liking this annotation feature. If you go back to your toolbox, there's like a little text feature and you could actually like type directly on the screen. It might look like mayhem when we when people start typing on the screen, but that's also an option if you'd like to test out that feature. But you could type in the chat or here, and I'm going to give you a few minutes to do this. The first thing that went on was CFR. I see that. Yep. Theoretical. Oh, yes, Zainab. Okay. Theoretical framework for acceptability of healthcare interventions. Yes, I've seen that before in many. So I do protocol reviews as well for the Gates Foundation, and that's come up a lot in the Gates Foundation work. Reaim also comes up a lot. C for EPIS, Reaim. Yep. Awesome. C for and Combi. Okay. So Nicole, your comment, CFAR and COMBI, but also Proctor's framework, highlights something about theories, models, and frameworks that I think is a really important point. Usually, you're not just using one to do everything. Like if you're doing a full implementation project, you're likely going to need a few theories, models, and frameworks to do things. Like CFAR and COMBI work together because they describe determinants of change at different levels of the system, like individual and like system level. And then Proctor's framework helps you look at outcomes. So they functionally do different things. So you might put them together. So thank you, Nicole, for that comment that you're using many things. Oh, I see that here. C for TDF, COMBI, REAIM, the theory, the acceptability and usability. Awesome. EPIS, knowledge to action. Priscilla, you're using REAIM and TDF. Yes, also. So I like that people are highlighting that they're using many things. Awesome. I'm going to clear this. I'm going to clear all these drawings, and then we're going to keep moving. And then I'm going to answer the third question. So we're already on question 3. We're chugging along here. What is the one thing I should know really well in implementation science? Why is this a question that gets asked? So I mentioned at the beginning that we do a lot of training in implementation science, and sometimes people receive this training and they get overwhelmed. And they're like, how am I supposed to apply all of this? Because there's so much that you can do and know about implementation science. How am I supposed to apply all of this to my work? What is the one thing that I should know very deeply that I should be applying right away? And so, like, I thought about this deeply. I was talking to my colleague Julia about it. We did some thinking around it. We talked to other people in the field, and we were like, you know what? If people are like, there's just, if I can only have the capacity to learn one thing, what is the one thing I should know? And we decided that it's this. And I'm going to walk through this diagram for you. People often struggle to understand how to select change strategies or implementation strategies, how to link them to underlying barriers and facilitators, and how to distinguish between what you're implementing versus how you're implementing it. Sometimes they conflate those two things. And I had mentioned I do protocol reviews for the Gates Foundation, and I've done a lot of work with different funders as well to review like the integrity of implementation science applications for different funding calls. And this is like something, some sort of gap that we've recognized that like people have difficulty differentiating between what they're implementing and how they're implementing it. And so there's a conflation of strategies and the intervention itself. And so this diagram kind of shows you what the relationship is between what you're implementing and how you're implementing it. And we simply call it the who's, what's, and how's of implementation. So you might be implementing a thing like an HPV vaccine. I keep going back to this because I was just reading a whole bunch of like research studies on HPV vaccination. So it was like top of mind for me. So like, let's say you're implementing this HPV vaccine, right? In order to implement it, you're probably asking, okay, to do HPV vaccination, who needs to do what differently in order to make this happen, right? Like there are people who have to do something differently in order to make HPV vaccinations become embedded into a system. So, for example, clinicians have to administer the vaccine. Girls of a certain age have to get the vaccine. So we have like who's and what's, right? In technical terms, this is called developing change objectives. We are developing objectives for change for each set of people or group of people who are involved in this change. Sometimes those changes could be super simple, and sometimes they can be kind of complex and a little abstract. But in this case, it's kind of simple. Like if you're a clinician, you're administering a vaccine, right? So clinician who, vaccine what? We know in practice that this is not perfect. Like just because you have a vaccine that's been shown to be effective and there's all these like guidelines that come out, et cetera, that it's not going to happen perfectly. There's going to be some variation in adoption and implementation of an HPV vaccine for a lot of different reasons. And that's where understanding people's barriers and facilitators to doing the what is incredibly important. Why are people not administering, why are clinicians not administering the vaccine the way they're supposed to be? So it could be a few things. Like, for example, it could be because they don't know that now vaccination is part of the HPV vaccine is part of the vaccination program, right? Like they just weren't aware of this. So maybe there's like a knowledge gap. It could be something else too. It could be like beliefs. Maybe they have certain beliefs about the vaccine. It could be that like this is a problem that we've encountered a lot in low and middle income countries. It's like literally a systemic issue. Like we don't have cold storage to store vaccines. So that could be like an organizational and system barrier, right? These are all things that impact this what, right? Clinicians can't do this because they're facing these barriers. So how do we alleviate these barriers through our implementation process? We select change or implementation strategies. They're called implementation strategies in the literature. We like to call them change strategies because they are meant to change something. So for example, if clinicians are not aware that HPV vaccines are now part of the vaccination program, you can make them aware, right? You can train them, you have educational materials, you have communication materials. So that would be a change strategy that you're using. If they have beliefs around vaccines, you might not be able to educate them out of those beliefs, right? Like it's not easy to say, like, here's a bunch of evidence and information, change your beliefs. You likely might have to change up your strategy. So it could be that you're also engaging opinion leaders or peers that are well respected to help deliver messages to influence or persuade clinicians to think differently about vaccines. If they don't have cold storage for vaccines, like a systemic issue, then the solution is we need to procure resources and actually get them the right things so they can actually have the vaccine there to be able to deliver it. So you could see that change strategies look different. There's a lot of different kinds of change strategies. They work at different levels, and they're meant to target these underlying barriers and facilitators so that you're actually getting to the root of change. You're actually getting to the thing that's making it difficult for clinicians to do this thing differently. So we think like this, just knowing the linkage between the who's and what's and the how's is an incredibly powerful thing that you can use moving forward. And the reasons why we think it's incredibly important is because like often when we're implementing, we kind of rely on certain strategies to implement. Like for example, we rely on training a lot. Every single thing that I've looked at or been part of always has some sort of education component first, which makes sense. But if knowledge is not the com or the major barrier, then it might not be as effective and we might need other strategies. So it's important to think about how we might select different kinds of strategies that actually target certain barriers and facilitators. So some takeaway points on how to do this. We built this process model that I referred to earlier. It's called the strategies pathway. It's a process model for delineating the who's, what's, and how's, and it takes you through that process that I just described. And there's four key milestones here, and we kind of go through each of these steps so that in the end you get to a set of implementation or change strategies. And if you're not using that strategies pathway, there are tons of other things you can use. So process models that you can use that help you get to this point are implementation mapping and the knowledge to action cycle, specifically the action cycle part around the funnel. Certain theories and frameworks can help you understand those underlying barriers and facilitators. So there's a consolidated framework for implementation research. There's Paris. There's normalization process theory. There's reference. A lot of people are using COM-B. COM-B is something you'd use here too to understand individual change. And then there's also approaches that you can use to help select specific kinds of strategies. So behavior change wheel is one that helps you understand intervention functions and different strategies you can use. There's that ERIC list of strategies that I had referred to before. And then there's also the C for ERIC matching tool. And then we have our own tool, the strategies tool, which I'll show you at the end of this presentation. So that's the answer to the third question. Now I have another short activity. What would you describe as a key who and what of your work? And what are some of the hows that you're using? So again, feel free to type in the chat, or I saw people liking the text function. You could text or put your text on the screen if you'd like to. But just it's a reflective question. Think about your own work and how would you delineate the who's and what's versus the hows of the work that you're doing? Okay, I'm going to get my move tool so that I can make sure that we can, here we go. Hmm. Who's and what's decision makers, what decision timing, how, blank. Who teachers, what mental health interventions in schools, how, blank. Does that mean that there's room for opportunity to be able to select the hows, and that's what you're looking to do in your work? That's how I'm interpreting that. Oh, sorry, Mark. Yours was timed out. It wasn't complete. Sorry. You could totally then go in there, or you could write in the chat if you have ideas to that. Okay, we have a few things in here. Who, patients and families, and policymakers. We have home and community care providers. What, delivery of safe pediatric home and community care. How, just-in-time training, simulation, engagement tables. Yes. That's a really good delineation of the who's, what's, and how's in terms of like the difference between these things, and this is what we're using to be able to get people to do safe pediatric home and community care. I feel like I gave people a bit of a deep question to do in like a 1 hour 1 hour learning series, but this is definitely something that you could reflect on if you're like, this is not easy for me to delineate in a few minutes. I would absolutely say take this question home and just be like, okay, I'm going to think about this to think more deeply about what we're actually doing. Yeah, Zainab's saying the how needs some thinking. That's often where people go when we say delineate it. They're like, what are our hows? What are we doing to help, change something about how people are going to do this thing? Yeah, multidisciplinary care team, what completion of data elements in clinical registry, and the how is simplifying the process and workflow. Priscilla, you're saying who, community partners, what, prenatal opioid education, what to expect when expecting, how, need to ask advisors and scope, what is available in the landscape. So you're still exploring that. Okay. I just saw a really long question or a long answer. So this is the last one I'm going to read out, and then we're going to come back together for our last little bit, just so I could explain to you levels of implementation research, and then we'll open it up for Q&A. Who? Behavioral health providers and facilities. What? Integrate tobacco recovery and SUD recovery programs. How? Trainings, professional development, decision maker education, continuing ed, decision maker, or change facility or program funding requirements to require tobacco treatment. So a lot of training, decision maker education. Yes, awesome. I'm going to thank you everyone for that. I would say again, like Zainab, you said, you're not sure about the hows. If you're not sure, I would say take that back to your team, think about it a little bit, see how you might complete the who, what's, and hows, like little diagram, um, just to like understand like what are we actually implementing? What are our strategies? What are our who's and what's? I think these are very good questions to ask and take home for your own work. Okay, final question. We're going to do this super quickly. How much implementation research am I doing? This question came about because I think that people who approach implementation science always think that they have to do a huge implementation research study in order to do it effectively. But there are ways to be able to embed implementation science into your research work a lot earlier on. And so, for those of you who have experience with implementation science, and it sounds like there are quite a few people in this room who like know about the theories and frameworks and processes and have exposure to it, um, this we developed this. You probably recognize some of this. This is a typology of like hybrid effectiveness implementation studies. So this is from Jeff Curran's paper on the type 1, type 2, and type 3 trials. If you have not read that paper, don't worry about it. You don't need to have read that paper to understand this. This is essentially like a categorization that we use based on that paper of the types of trials to understand how people are doing implementation research and embedding it into their work early on or like further down the line. And we developed this at the Gates Foundation because we were seeing that like there were research studies coming down the pipeline that had like a little bit of implementation research and then some that were like full-blown implementation research studies. So we call this IR light. And this is when you are doing an effectiveness study, but you have some implementation questions. So you want to like preliminarily explore some implementation questions. So for example, is this intervention feasible and acceptable? Or what are some of the contextual determinants around these things? So you might want to like start like gathering some implementation information that could inform a future study or it could inform some more practical considerations around implementation of this thing that you're studying. So we call that IR light. There's another level that you can be achieving of integrating implementation research into your own effectiveness research. It's called IR balanced. And it's essentially when you want to understand the effectiveness of something while also simultaneously focusing on how it's being implemented. And we're seeing a lot of studies that have balanced aims when it's something that has like a huge policy priority or it's showing early signs of effectiveness and they want to like gather a lot of information on how it might be rolled out earlier on so that it's not like a long, many years process to figure that out. It's like trying to gather both pieces of information at the same time. So there's like a quicker policy scale up and that you're not waiting for a long time for those results. IR dominant is what we call studies that are focusing fully or more fully on implementation strategies. You've probably established effectiveness of these of the intervention already, and you might have a few effectiveness questions left, but by and large, you've already done some studies to understand effectiveness, and you're really looking at that implementation piece. And then IR full is like you're fully doing an implementation study. You know that something's effective. Like, for example, like kangaroo mother care. Like, we know it's effective. You don't need another study on it. But you might be wondering, how can we best implement this? And that's a full IR study dedicated to understanding implementation fully. So I think the point, like the bottom line here, is that to do implementation research, you don't have to always do it fully. You can start early and you could embed it into your research work at different levels in different ways. And so you can probably guess where this last activity is going to go. So I'm going to ask you, we're going to go back into Zoom annotation, and I feel like many people are proficient at Zoom annotation. I would love to know, how much IR are you doing? How would you classify your own level of IR that you're currently doing? So use a check mark to like signify, are you doing IR light, IR balanced, IR dominant, or IR full? And use a heart if you'd like to explore other kinds of IR, use a heart to signify that. So like, let's say if you're doing IR light right now, you'd love to do it. You use a check mark, and then if you want to do like more IR full, you could use a heart. So we're seeing people all across the spectrum. A lot of people embedding little bits like IR lights. So again, if you want to go back to the official typologies, that would be more like a type 1 hybrid study. And then there are people who want to explore all kinds of studies, and they're all legit kinds of studies. There's like no wrong or right way to approach this. And I would say the earlier you start asking questions about IR or implementation, I think the better. It just makes things a lot more clearer in terms of how you're going to approach it later on. You have IR dominant, IR balanced. I'm reading the chat to move from IR balanced to IR dominant. Yeah. And I think it's like when you have more effectiveness or when you're doing more effectiveness research, you kind of like might eventually move that way. You do have to have a basis of effectiveness of your intervention before you move on to the dominant and full types of IR. Awesome. So I'm seeing like people who want to do all sorts of IR light, IR balance, dominant and full, and people are all currently doing all sorts of IR right now. Awesome. I'm going to clear this. I'm just going to show you super quickly some tools and resources. So you're like, so many of you are using things like the COM-B, the behavior change wheel, TDF, etc. If you're using these or thinking about using these, we have a tool that helps walk you through the process of applying these and selecting strategies that align with certain determinants in the theoretical domains framework and the COM-B. We are producing an updated version that's going to include contextual factors. So if you'd like a full list of all the determinants of change and all the different kinds of strategies that could align with it, please keep us, on your radar. We're going to be releasing this new version. Right now, it's focused on that individual level, the COM-B and the TDF. It's a free interactive tool. You can use it with your team whenever you want and access it whenever you want. If you're doing implementation research, which a lot of you are, and you haven't yet seen this logic model, we do recommend using something like the implementation research logic model to help you kind of walk you through the difference between your intervention and your strategies and what you hope it will achieve. So that theoretical component. And so we have the reference at the bottom of that screen. And then I think you'll be getting copies of these slides, maybe. I think so, but if not, this is like we're just holding this here. Here are some additional resources for you if you want to read more about implementation research in general or implementation science in general. Noting that the very last bullet point, we have a toolbox that makes a lot of things available to you, like articles, images, frameworks, etc. So, and it's everything's freely available there. So if you access our toolbox, you can go through a lot of these things and kind of sift through all these resources that we have. Some next steps before we get into the Q&A. We have all of these things that we provide for people to get you into the implementation science space. So I mentioned the online interactive tools. So strategies is one of them, and we have other interactive tools as well. I mentioned the toolbox as well already, so I described that to you. If you are looking for more training on implementation science and what kind of like a free overview of it, we have a free mini course. It's all the content is under 2 hours to go through. We have a newsletter. We have over 10,000 people who've joined this newsletter that we release monthly, and we have all sorts of resources. We have like descriptions of like new topics, etc. So you can join the newsletter. And then we also have a change community as well. So I want to say thank you so much for being a very attentive audience. And I'm going to move to the Q&A. We have a few minutes left for any questions that people might have.
Thank you so much, Sobia. Like, I truly appreciated the points of engagement that you embedded throughout your presentation. So it gave us an opportunity to break, pause, reflect, and also learn a little bit from others on the call. I do want to open it up to those on the call to ask their questions to Sobia. Please feel free to raise your virtual hands. You're welcome to also enter in your questions into the chat. I'll keep an eye on that. So please feel free to take a moment to do so. So we have a question in the chat, Sobia. Can you comment on the differences and similarities between frameworks for implementation science and those for quality improvement?
Yeah, we get that question a lot because there's obviously a lot of similarities, right? Like the goal is very similar, right? Where you're trying to implement something, you're trying to reach certain outcomes. I would say that the differences between quality improvement and implementation science is that I find that implementation science focuses more so on those mechanisms of change and how to select change strategies than the actual like improvement cycles and how you can iteratively create improvement within organizations. Like I feel like we're not so good in implementation science about describing that as much as quality improvement is. And then in quality improvement, if you like use only a quality improvement framework, you're not capturing the process of selecting strategies, understanding those contexts deeply, et cetera. And so I can see, like I've done research projects before where we've embedded or integrated quality improvement frameworks with implementation science frameworks. And the way that we did this was we planned it using PDSA cycles and like the continuous quality improvement cycles. And what we did was we embedded implementation science processes and principles within the planning and the studying pieces to understand more of those implementation outcomes, as well as to understand how to select those implementation strategies a bit more. And so, like, they can fit together, and I think they're complementary, and ultimately they're trying to achieve the same thing, but just using slightly different approaches to do it. So I see them as very, very like in step.
Perfect. We have another question in the chat. Can you please clarify the theory component in the who, what, and how slide?
Yeah, sure. Let me go back to that. Oh, right here. So the theory component, so usually when we are trying to understand barriers and facilitators, like when you're officially applying implementation science, what you're doing is you're applying theory to understand what those barriers and facilitators are theoretically and how they act on a certain kind of behavior. So this is like the kind of the integration of behavioral science with implementation science, where you're really trying to understand those mechanisms of change. So like the barrier might be knowledge, right? Like so the barrier might be I don't know something, and then theoretically that links to the determinant of knowledge, which theoretically links to some sort of mechanism of change that works on some sort of outcome. And so, like, I didn't want to dive deep into that because we only have an hour. We could probably do a whole session on what theory is, but essentially, what you're doing here is you're applying theory to unpack what that means and what the relationships are between that barrier and what is happening to people's behavior. So, using, for example, COM-B, the capability, opportunity, motivation, behavior theory, helps unpack a lot of like what barriers and facilitators are doing to people's behavior. So that's that. So like again, I can't go deep into this here, but that's what you're using to unpack the barriers and facilitators.
Perfect. We have quite a few questions entering the chat. Can you elaborate on the mechanisms of change? And is the how component or any different? Oh, is that the how component or any different?
The mechanisms of change.
Mhm.
So mechanism of change is like describing how you think change is going to happen, right? And so if you think of like building your program theory or your theory of change, you're describing like what you think is going to happen. So mechanism is like the simplest mechanism, if I go back to knowledge, is if we increase people's knowledge, they are going to more proficiently perform a certain practice, which means that this is going to impact our outcomes in certain ways. And so that is like a mechanism of how we think change is going to happen. And so the how kind of feeds into that. Like they're different because the how is like if we teach people using these education components, then their knowledge is going to build up. So there's a strategy that works on a change mechanism that produces some sort of outcome. So there's a relationship between them, but they're not the same thing. I hope that's clear the way I described it. But like the mechanism describes how we think change is going to happen. And I would highly recommend if you're doing implementation research to learn how to build that. That's why I showed the logic model at the end. I suggest you go to that paper and it really helps you understand how to build those theories of the mechanisms of change and understand those mechanisms of change as they relate to the strategies and the outcomes.
That's a really good suggestion. And I think the next question is probably one that others are burning to know the answer to. Any advice on introducing implementation science research to an organization that is new to research in general and wants to publish, to move a field forward? So that introductory piece.
Yeah, I would say that, oh, this is an interesting question. They're new to research in general and wants to, so if they're new to research in general and they want to publish to move the field forward, okay. So I would say that there are a lot of places, so there's a lot of different topics in implementation research that might pertain to what is like of interest to an organization that's new to research in general. So for example, you could be looking at the strategies piece, but there's a lot of people who focus on specific aspects of implementation research, like how do we understand context or how do we adapt something for different contexts? How do we build out better and more theory-informed implementation evaluation plans? How do we do, better context assessments? How do we understand readiness? So I would say just like find the thing that aligns most closely in implementation science to the vision and mission of your organization and what's happening, and then introduce those topics first. So, meaning like you're looking for the value alignment and the topic alignment of what you're trying to achieve as an organization and what's pertinent to them in implementation science, rather than introducing them to the whole field, because there's a lot of things they could potentially be doing in implementation science. Because I think the objective is like to get them on board with, hey, this is a way we should be thinking about these things that are important to us. Sometimes when you pummel people with a lot of information at first, they're like going to tune out. So you have to like give them the pieces of information that are going to be the most relevant to them first. I don't know if that's a clear way that I described it, but that's what I tend to do when I'm introducing something new to an organization. I try to figure out what would be the most relevant first, and then I build on that knowledge once I kind of have that in first.
Perfect. And I think given timing, I'll ask you one more question to
Okay.
address, which is what strategies help ensure that implemented interventions are sustained after a study ends?
Oh man, that's so that could be a whole other
Yeah.
workshop. And I think the answer is I think that depends. It depends on a lot of things. Um, I would say the general recommendations that I have is to think about sustainability before the study ends. And so you're not thinking about, okay, well, now that it's ended, we're going to do these things. I would say, for example, a lot of funding in a research study goes towards personnel. And then when that funding expires, then there's no longer personnel to help perpetuate something or to implement something or to keep it going. So you have to have a strategy for like, how are we going to continue this prior to the end of funding? We can embed this thing that this personnel is doing into existing roles so that there's a handoff at the end of the study. You have to know your context and what's changing in your context and also like what the funding environment looks like. You have to know who's actually going to be there to champion this. So I think doing some sort of like analysis of the sustainability context And then picking strategies that align with that context is really important, which is why I said it depends, because there could be a lot of different strategies that you use. But the biggest mistake, I would say the number one biggest mistake that I see in sustainability is people use funding for personnel and don't have a plan for how that person's role is going to be transitioned when funding ends.
That's really great. Thank you so much, Sobia, and for everyone joining today's call. I acknowledge that there are still some lingering questions in the chat that have gone unanswered. I encourage you to reach out to Sobia, the Center for Implementation, if you'd like to continue your learning within this space. Our next session will be held on March 11th, which I'm excited to share, where we'll welcome Dr. Sarah Munz from Holland Bloorview Kids Rehabilitation Hospital to come and speak. She'll be presenting on a recent co-design project that she's been involved with that's focused on developing reporting guidelines to support transparent reporting of co-design research in health, the health space. So hopefully you'll come and join us for that session. I wish you all a wonderful rest of the day. And thanks again to our speaker for a wonderful, wonderful, excellent presentation. Thank you.
Thank you, everyone.